We explain a respiratory disorder called pneumonia. Meet Mr. White. He had a sudden onset of fever with a temperature of greater than 100 degrees Fahrenheit and shaking chills. He was also having some purulent sputum when he coughs. Mr. White becomes alarmed because he was having chest pain aggravated by his hacking cough. Mr. White decided to go to the hospital and was assessed by a pulmonologist. His chest radiograph shows density changes, primarily in the lower lung fields. Sputum culture and sensitivity are positive for a specific causative organism. White blood cell count is elevated. Mr. White was later on diagnosed with bacterial pneumonia. Pneumonia is an inflammatory process involving the respiratory bronchioles, alveolar space, and walls, and lobes, caused primarily by chemical irritants or by specific bacterial, viral, fungal, mycoplasma, or parasitic organisms. Mr. White suffers from bacterial pneumonia. It is basically caused by the following organisms: 1. Streptococcus pneumoniae, 2. Staphylococcus aureus, 3. Haemophilus influenza, type B, 4. Klebsiella pneumonia, Pseudomonas aeruginosa, Escherichia coli, etc. Mr. White was prescribed antibiotics, aminoglycosides such as gentamicin and tobramycin, amoxicillin, erythromycin, penicillin, and tetracycline, and mucolytics, N-acetylcysteine, benzonatate, guaifenesin. After being compliant with his prescribed medications, Mr. White is now able to go back to his life as before. Upon follow-up, his chest X-ray shows no significant findings and with a normal complete blood count result. Bacterial pneumonia is an infectious disease, which means it can be transmitted from person to person. The best defense in infectious disease prevention is through hand washing. Make sure to wash your hands at all times for at least 2 minutes. Since it is a respiratory disease, it can be transmitted through droplets, while sneezing or coughing.